the treatment for generalized anxiety involves three things. One is education about what the disorder is, that it has a name, and that it likely is treatable. It's not just the way I'm made, because a lot of people with generalized anxiety think, well, that's it. I mean, you know, I don't know why I do this. It must be the way my brain is made. It's not that they have a disorder which has a name and they can be treated for. So education is one. Therapy, including cognitive and behavioral therapy. Cognitive therapy involves changing the thoughts or cognitions that people have. When people get anxiety disorders, they begin to do all kinds of things to misinterpret what they're seeing, to look into the future and say, well, gosh, if this is how terrible I feel now, God knows what I'm going to be like 5 years or 10 years from now. They tend to see things as all black or all white instead of necessarily shades of gray. They tend to label themselves with mislabels, such as, I must be sick in the head, I must be psycho, I must be mentally deranged, whatever it is. And cognitive therapy looks at those cognitions or thoughts and helps people challenge them. In addition, the learning of behavioral techniques involving deep breathing, relaxation, meditation, and the like may be very helpful. And then the third part of treatment is medication. The drugs we typically call antidepressants, whether they be the new generation drugs like the SSRIs such as Prozac, Zoloft, Paxil, Lexapro, Celexa, Effexor, Cymbalta, or the older drugs we call tricyclics with names like Elavil or amitriptyline or tofranil or imipramine. Those kind of drugs can be helpful. And for some people, the monoamine oxidase inhibitors, the drugs with names like Nardil and Parnate, or the modern patch called MSAM, may be helpful. And in addition, those drugs which treat the anxiety itself, drugs with names like Xanax or lorazepam, Ativan, may be helpful for patients.